Hello all, today we are going to discuss about the dry socket, its causes, symptoms, treatment and prevention. To begin with, dry socket or alveolar osteitis is a painful post-extraction complication characterized by premature loss or failure of blood clot at the extraction site, leading to exposed bone, delayed healing and severe pain. Dry socket is called dry because the extraction site appears empty or dry due to the absence of blood clot that normally fills the socket after the tooth removal. Without the clot, the underlying bone and sometimes nerve endings are exposed, giving the area a dry and a bare appearance instead of moist, clot-filled look typical of normal bleeding. Some of the other names for dry socket are fibrinolytic alveolitis, post-extraction osteitis, local osteitis or dry socket syndrome. As we have already discussed, that dry socket happens when the blood clot that forms after a tooth extraction either dissolves or does not form properly. So anything that interferes with the formation or stability of the clot can lead to a dry socket. It might be trauma during the extraction. A difficult or surgical extraction can irritate the socket, making it harder for a clot to stay in the place. Poor oral hygiene of the patient because the bacteria in the mouth can infect the extraction site, preventing proper healing. The chemicals in the tobacco reduces the blood flow when the patient smokes to the area of extraction and interferes with the clot formation. Use of straws or spitting creates a suction, and this suction created when drinking through a straw or spitting can dislodge the clot. Apart from this, the women on oral contraceptives or during their menstrual cycle may have the higher risk due to hormonal effects on healing. Discuss the pathophysiology of dry socket, but before knowing the pathophysiology, first we should be aware of the physiology of normal healing of a socket after the extraction. First of all, the stage 1 is the hemostasis and the coagulation. In this phase, the body works to stop the bleeding by constructing blood vessels. A clot forms in the socket, providing a foundation for the next steps of the healing. This stage happens very quickly and within hours of extraction. The stage after hemostasis and coagulation is inflammatory stage. Once the bleeding is stopped, inflammatory stage begins. This phase is characterized by an immune response where the white blood cells rush to the site to clear out any debris and fight potential infections. This stage typically lasts a few days and sets the stage for tissue repair. Third stage is proliferative stage, which follows as the body focuses on rebuilding. New tissue including bones, soft tissues begins to form in the socket. The body works to restore the damaged area and bone formation starts. This stage can last several weeks to months depending on the individual's healing rate. The final and the last stage is remodeling stage. In this stage, the newly formed bone undergoes reshaping and adapts to closely resemble the original alveolar bone. While the formation of the bone occurs relatively quickly, this reshaping and final remodeling process takes much longer time, often continuing for months to years after the tooth extraction. To summarize with, the healing of extraction socket involves 4 overlapping stages that are modulated by various growth factors and cytokine. A complete sealing of the socket with mature mineralized trabecular bone and the marrow is achieved around 12 weeks on an average. In case of a dry socket, the blood clot is lost either because it dissolves too early or gets dislodged. Without the clot, the underlying bone and the nerves are exposed. This causes severe pain, especially when the area comes in contact with air or food. The open socket becomes an entry point for bacteria, leading to inflammation and delayed healing. And the factors, as we have already discussed, like smoking, poor oral hygiene or trauma to the area can disrupt the normal healing process, leading to a dry socket. Coming to the diagnosis part, the diagnosis is made primarily on the basis of the clinical examination. This involves looking inside the mouth at the extraction site to check for any signs of the dry socket. Dry socket is characterized by severe pain started a few days or 3 to 4 days after the extraction, to be more specific. and patients typically report sharp throbbing pain in the area which may radiate to ear, jaw, or temple region. The socket will appear empty, meaning the usual blood clot that should have been formed post extraction is either absent or dislodged. This leaves the underlying bone exposed. Normally, a blood clot forms within first 24 hours after the extraction, protecting the bone and promoting healing. In the dry socket, the absence of this clot is a key indicator. Detailed patient history should be taken to rule out or identify the potential risk factors for dry socket. Although dry socket is primarily diagnosed through the clinical examination, imaging may be used if the dentist needs to rule out other possible causes of pain or delay in healing. X-ray may be ordered to check for any retained tooth fragments or bone chips that could be contributing to the pain. If a root was broken during the extraction, it may not have been fully removed, or this may mimic the symptoms of dry socket. One of the most important aspects of dry socket management is pain relief in the patient. The pain associated with dry socket is severe and can last for days, often requiring immediate intervention. The dentist will typically start with the over-the-counter pain relievers like ibuprofen or acetaminophen to manage the mild to moderate pain. For the severe pain, stronger pain relievers may be prescribed. Socket cleaning is necessary to ensure the wound stays clean and to promote healing. The irrigation of the socket will be done with the sterile solution such as saline or antiseptic to remove food particles, bacteria, and any debris. This prevents infection and helps to ease the irritation in the area. Cleaning the socket, it is usually packed with a medicated dressing to protect the exposed bone, soothe the pain, and encourage healing. The medicated dressing which is most commonly used for dry socket is eugenol based paste or paste with an antiseptic. This paste has a soothing effect and it is often changed every 1 to 2 days until the pain of the patient decreases. Other dressings, in some cases other materials such as iodoform gauze may be used. These dressings help to protect the exposed bone and reduces the inflammation. Regarding the use of antibiotics in dry socket case, it does not typically require antibiotics if there is a risk of infection. For example, if the socket becomes contaminated with the bacteria, or an antibiotic may be prescribed. If there is evidence of infection in the socket like swelling, pus, or fever, the dentist may prescribe oral antibiotics to prevent further complications. The patient should be provided with the post-treatment care instructions to help manage pain and prevent worsening of the condition and to promote healing. Patient should be advised to avoid smoking for at least a week after the extraction. The patient should stick to soft food and avoid hard, chewy, or hot food that might irritate the extraction site. Also, the patient is advised to gently rinse the mouth with warm salt water after the meals to keep the socket clean. Care should be taken not to dislodge the dressing or cause any further trauma to the site. A follow-up visit of patient to the dentist is crucial for monitoring healing and replacing the medicated dressing. The medicated dressing should be changed after every 1 to 2 days for the several days to ensure the socket heals properly and the pain diminishes. If there is any worsening of symptoms with increased pain, swelling, or fever, further treatment or adjustment may be necessary. If you found this video helpful, don't forget to like, share, and subscribe to stay updated with more insightful content. And have any questions or the suggestion, drop them in the comment below. Hit the bell icon so you never miss an update. Together, let's learn and grow. See you in the next video. Till then, bye bye. Take care. Have a nice day.